Top 5 tips for doctors and nurses to protect themselves from novel coronavirus COVID-19. The newly recognized virus COVID-19 is proven fatal as well as contagious on a massive level. Since being upgraded from an epidemic to pandemic by the World Health Organization, it has slashed many economies around the world and caused a great deal of anxiety and chaos. With a huge number of businesses shut down and people out of work, doctors, nurses and medical staff overworked and anxious to save and care for patients every second of every minute of every day. There are so many reports and articles in newspapers, videos in social media, giving helpful tips for the elderly and the young on different ways to prevent contamination from the virus. But there is no proper content available to inform and help the doctors and nursing staff about protecting themselves from coming in contact with this dreadful disease. Sadly, a considerable number of doctors have died worldwide due to exposure to the virus. They have lost their valuable lives working 24/7 trying to help their patients. Please show your respect and gratitude to these brave, dedicated and selfless individuals by clicking the like button to this video. This video is from Hospital Success, who greatly appreciate and care for our medical soldiers and would like to address the top 5 precautions to take while treating patients. 1. Wear protective masks, clothing and gear. The whole world is suffering because of this pandemic. We strongly recommend wearing masks and hand gloves for all health workers, even if you are not treating corona patients. This is essential because of the large number of people visiting clinics and hospitals daily to get them treated and tested for various illnesses and potential diseases. You never know who has contracted the disease. COVID-19 symptoms can only be detected within 14 to 21 days after infection. However, a person who is asymptomatic can spread this virus without his or her knowledge that they are carrying the disease. So ask your patients and their attendees to wear masks before entering your space. 2. Keep hand hygiene a top priority. It is extremely important for all healthcare professionals to wash hands frequently and wear hand gloves. It is a must to use an alcohol-based sanitizer after attending to every patient or handling materials and equipment. In your clinic or hospital, make it compulsory for all your team members to wash their hands with soap or sanitizer frequently. Ensure that sanitizers be placed at your reception desk for patients, carers and visitors who have come for medical consultations. 3. Keep isolation wards away. Due to the huge level of traffic, many hospitals and healthcare centers are coming up with isolation wards to treat COVID-19 patients. As per the World Health Organization's guidelines, an isolation unit must be located far from the main hospital in order to reduce the spread of infection. The staff at this unit should not be rotated to the main hospital. Ventilation is important to reduce the transmission of airborne spores, and the most serious and severely affected patients must be placed in separate wards and ICUs. Protective clothing and ventilators are extremely important to be maintained at the Corona ICU. 4. Boost your immune system. In these stressful times, it is also necessary for all healthcare professionals to boost their own immune system. Proper diet, sleep and stress levels are essential to every person's general health and well-being. It is also very important to take adequate breaks between patient services. The spread of the virus has a lot to do with the quality of the individual's immune system. It is the same for doctors too. Therefore, it is essential that the right amount of food and water be consumed throughout the day. You should drink lots of water to keep yourself hydrated and not miss your meals. If this is not followed, it can also lead to other health issues. 5. Test yourself frequently. As many doctors and nurses are working extremely hard to treat COVID-19 patients, they have proven to have a higher risk of infection. If at all you are experiencing any symptoms of the virus, get yourself tested immediately, even if that means getting checked 2 or 3 times a week. This is because, as we said earlier, the disease is not only highly infectious, but symptoms are only visible after 14 days. Precautions are always better than a cure. Lastly, through this video, Hospital Success would like to salute all doctors worldwide. We would also like to thank them for their selfless service and sacrifice to help the patients fight this disease. The world would have been a chaotic and disastrous place by now if there had been no doctors. You are the heroes, gems and saviors of society. Hospital Success pays grand tribute to doctors and nurses. Please subscribe to the Hospital Success channel to get more updates.